If you're working on voice feminization, then you're going to describe resonance as being more oral, more forward focused, associated with a head voice, and you might even describe it as a light, vibrant, clear sound. And you're going to have increased pitch with more pitch variability. If you're working on voice masculinization, then you're going to describe resonance as being more chesty, guttural in the throat, more dark sounds, and it's associated with a deeper pitch and less pitch variability. So before we move on to the next slide, I want to say a thing about hormones. So for trans women, estrogen does not have an impact on the voice. So taking hormones for trans women doesn't help transition their voice. I have had a few clients tell me that they feel their voice softened, but not to the degree that testosterone impacts the voice. Testosterone, on the other hand, as we know, does thicken up the vocal folds, which results in that deeper sounding voice. However, again, there are trans men out there that will seek out services to either further deepen and masculinize the voice, and if they're not taking hormones, they may need your assistance, or perhaps they've taken hormones, their voice has lowered, but they have other vocal needs because they are a performer, a singer, and so they want to maybe regain their full range. Once nasal resonance is established, you want to train oral resonance because your client won't be only speaking with nasal consonants. For me, I have found the yonsai to be really effective in moving the nasal resonance into the oral resonance. The yonsai can be a great technique. So I pair it with starting with that big inhale to trigger that yawn, and then I move it into the hum and then open their mouth for the sigh. So it sounds like this. This also triggers deep breathing, which is really important in resonance training. I recently had a great discussion on a Facebook group, and two of the strategies that were talked about was cueing a client to blow out breath for resonance so that it doesn't get caught up in the throat, but that the support actually comes from the muscles that help us to exhale. And the other one was energy through the line. So again, going back to that guided visualization of thinking of your breath as the energy that powers the voice, and therefore the voice is also energy. So taking in that big voluminous breath to then produce that voice and keep and carry that energy through the end of the line. These are some cues that have really helped my clients. So moving on to intonation, let's talk about the differences in typical male and female intonation patterns. Feminine intonation tends to be more variable and melodic. A lot is communicated with feminine intonation and inflection. Masculine intonation tends to be less varied and more monotoned. So when it comes to teaching intonation, especially to trans women, can be a little more challenging as you're working on breaking out of the monotone speech and into more melodic, colorful, and highlighted speech. Intonation is not the same as increased volume. A lot of clients who are aiming for more feminine speech will get loud to highlight their words and intentions, okay? So paying attention to that and clarifying that is important. Let's talk about the use of technology, documentation, and data collection. So depending on the nature of your setting, you may or may not have access to high-tech equipment that allows you to gather various kinds of data on your client. If you have access to high-tech equipment, you should use that and utilize what is appropriate for your client. In my experience, I have found that gathering fundamental frequency through a third-party app is often sufficient for me. I work in my own private telepractice. I work from home, so I don't have access to high-tech equipment, so I've utilized the Voice Analyst app. It is $10, and if I'm treating someone live face-to-face, I will just use that app to track their fundamental frequency at the initial intake and through our sessions. But there is a really great app out there called Voice Tools, and it is free. And so if I'm doing more of a teleconferencing session, I will ask the client to download that app and then give me the numbers.